働き方明けサイトポスト
It all started with women's health.
もちろん最初は女性医学から
And in our professional organization in the United States, the American Physical Therapy Association, we have
理学療法士協会は
a section called the Section on Women's Health, and that was established, I believe, about 40 years ago,
40年
who would work with women who would have urinary leakage, so incontinence. They would also work with women who would have prolapse, so their organ, their pelvic floor has become lax, and therefore it drops, and so that either the rectum, the uterus, or the bladder would drop, so that's prolapse, and so they do training for the pelvic muscles to help support. And they would also work with women with issues after a mastectomy, so for breast cancer, which would include like lymphedema or soft tissue mobilization, scar mobilization. So that was kind of the root of
それが最初です
this kind of gender-based,
その
and just over time, slowly, men's pelvic issues became a little bit more prevalent. Part of it is the medical community at large learning about how to diagnose things better, identifying that doing pelvic rehabilitation was helpful for men in certain, with certain disorders. And therefore, just over time, the natural evolution of recognizing that, hey, maybe we should refer these people to someone like a physical therapist who might be able to help them. And so it's become a little bit more prevalent. It's still fewer than needed. I mean, there should be more physical therapists working with these men. But now there's many female physical therapists who see men. Before, they were some were very comfortable with seeing men, and some were not comfortable with seeing men. And now we've started to develop some groups, and we're just starting now to have what's called a male pelvic health special interest group within our American Physical Therapy Association. It's still under women's health section, but there's also a task force. It's called the Name Change Task Force, which I'm on too, representing the male piece, to change that name. Because under women's health is pelvic health for both women, men, and children. And the name women's health no longer represents the full group that they actually serve or represent. So we're in this time right now where these decisions will be made, and eventually, I mean, it may take a year or two or so, but the name of the full section might change to be better representative of the patient types and the physical therapy specialties that they. But really, this is a muscle. It's a musculoskeletal problem, like muscles everywhere.
体と同様に
But because it's in this area of the pelvis,
ちょっと別に
and there is separate knowledge base of how the bladder works and the bowel works, but really it's a musculoskeletal disorder. Yes. So the research that I'm doing, I'm the clinical collaborator for a research lab at our physical therapy school.
人がいて
And what we're researching is mainly from a pelvic pain perspective,
骨盤で
to understand better why these muscles might be.
なんです
Now, it's a similar group of patients that might have this tension here, that might have, as well as maybe people who sit down a lot, patients who have some anxieties or nervous disorders. But not everyone has that, but those are classifications that we're identifying. And we just published a paper a couple months ago establishing that the gluteus maximus
大
and the pelvic floor muscle
骨盤
are linked
リンクし
with
て
a cortical
大
synergy
の
where we can contract our pelvic muscle alone
骨盤って
and glute stays quiet.
骨盤
But if we contract our glute, our hip extender, this goes every time. It goes with it. So we're looking to see now that if we know that happens in normals, So this is a body region that we all have,
みんながある。
and it's a body region that not very many healthcare professionals, if we say physical therapists, want to treat.
あの
But there, here in the United States, this country, there are 12 to 18% of men who have pelvic pain and tension issues here.
Yeah.
And in the United States, 1 out of 6 men is diagnosed with prostate gland cancer. So there are many people, probably in your country also, who could use their help. And it's really not doing things very different than what you would do in another body region. Because we're going to educate,
まあ
we're going to perhaps do some manual therapy, we're going to teach exercises, body awareness training, factor into like ergonomics and positioning,
で
and help a lot of people.
でそれで
So it's something that can be very rewarding because a lot of these men have these issues of incontinence or pain or voiding problems, which really come down to being a quality of life issue.
本当に
And sometimes helping someone with these problems that we usually don't think about in life at all. Like we take for granted our ability to hold our urine and to evacuate well. And just a few key things that we can do can really help a population. And therefore, it becomes rewarding to you, but also to see these patients be able to return to some of their life events with an improved quality of life.